Hi everybody, it has been a long time since I've been on here to update this vlog about my cancer journey. So I apologize about that. I am learning that the days that I'm feeling good are becoming few and far between. So my gap of like feeling good days used to be Monday through Wednesday. Now it's starting to kind of seep into like a little bit of Tuesday's been a hard day lately. I don't know why. It's like right in the, right in the middle. Like I'll feel really good on Monday, then Tuesday I don't feel too good. So anyway, I haven't updated this vlog for a while. I have been doing updating posts on Facebook. So if anybody wants to check that out, Carly Edmund Craig is where you will find me and you can follow me there. So I just wanted to do an update now with the last few weeks because I don't think I've been on here since my second treatment, chemo treatment. So I remember the last time I posted, I was like, it's going so well. And then that night after my second treatment, I ended up spiking a temperature and I ended up going into the ER the next day. So when you spike a temperature as a cancer patient, that's like a really big deal. They want to make sure that you are not developing an infection. I guess you're more prone to this as a cancer patient. So I was admitted into the hospital and they drew my blood. I can't remember what they even really call this, but they have to draw your blood and like they send it out and they watch it for up to 72 hours to see if anything grows, any kind of bacteria, and this helps them determine whether or not you have an infection. In the meantime, they do treat you, your problem, your fever, as if you have an infection. So I was on antibiotics, a lot of antibiotics intravenously through my port, and also a lot of saline. And I spent, let's see, Friday, Saturday, Sunday in the hospital and then went home on Monday. So that was very unexpected. As it turned out, there was nothing they could find in terms of infection. It could have been that I was on the brink of getting some sort of virus and my body was flipping out because I did become neutropenic in the hospital, which means that basically I did not have any white blood cells left. So they had this like sign on the door, like, she's neutropenic, be careful, so people would mask when they would come in, which was good. But yeah, it was just kind of weird. But the time in the hospital went okay. One of the things that helped me, and this is going to sound bizarre, I tried to think of how could it be worse, right? And beyond the obvious of I could be hospitalized because I'm dying or something like that, really what I struggled with the most that I had to kind of mindset was the fact that I was really enclosed in like one room. I was encouraged to walk a few times a day, just around my floor though. I wasn't supposed to go anywhere else. So it was like taking these laps with my pole, with my IV pole that I named Stewie, taking these laps around my floor. And other than that, I was like in my room. So I tried to think about how it could be worse. And the thing that popped into my head was that book Room, based on that true story. It's a movie also, but I read the book first, seen the movie years ago. That book Room is based on a true story about a teen that is trapped in, well, the true story is she's like trapped in the basement of her house. And she's captured there for like, I don't know, you guys, like 30 years or something. And she like has all these kids and that she ends up having. It's just terrible. So I thought, okay, if Room Girl can do this for like 36 years, I can do this for a few days. And honestly, it helped. You have to switch the mindset. Another thing that helped was realizing that, I am a cancer patient now. This is kind of my main job, is to get better. That is my main focus. So I been having to really learn to go with the flow and to not be able to just plan on things. You really don't know for sure how your day is going to go or what's going to happen. And you cannot get yourself super upset about it because this is the journey. So that really helped me. Since then, I have not had that happen again, which is wonderful. I just finished my 7th treatment of chemo today. Today, I had the Keytruda immunotherapy, and I had Taxol and carboplatin. I yeah, I had a fun, you know, I always have fun at chemo. That's going to sound kind of crazy, but I love people, and I have a favorite nurse that does my blood draws. I love my oncologist, and I love meeting with him. And I also love the oncology nurses that take care of me. I've had like so many different ones, and they're all just amazing in their own way. This is a cat tail, by the way. Sorry. My cat, whenever I sit down somewhere, my oldest cat likes to just come with me. So, yeah, so chemo brain, real thing. Where was I? Oh yeah, I love all my nurses and stuff. So really, chemo day is not a bad day. I usually feel good on chemo day. I don't feel bad after the treatment. My only complaint the day of treatment is I am wired. So from now on, I am going to try to be really good about doing a video vlog on chemo day, because this day is the one day per week I know for sure I'm going to feel good. So that's our plan. Okay. We're going to try to update this thing weekly. Beyond that, let's see, those of you that are friends with me on Facebook or follow me, you know that I went ahead and got my hair shaved. So I was losing hair all over, you guys. It was like anytime I showered, it was just coming out. You wouldn't believe, like the rat's nest I would take out of the drain, and then I would brush it and it would come out in chunks, and it got really thin. And I am still working Mondays through Wednesdays. I'm a teacher, and I thought, this is really like exposing my head. I don't really care that much, but it's the fact that I work with children. I didn't want it to upset them. So I started wearing my wigs at work, and I also went and got my hair shaved. So, yeah. And you know what? I will tell you, it is so freaking freeing. I love it. Let me show you real quick. You'll see it's really thinned out a lot, and I have a lot of gray because I am a girl that when I don't have cancer, I get my gray covered up. I started graying a few years ago, and so I have like splotches, you know, splotches of like gray when I don't. But anyway, here's what my head looks like. Don't I look completely different? My skin's looking really bad today too. But yeah, that's what it looks like. It's really thin. It's thinning out. I have beautiful wigs thanks to my mother, and I also have some really nice scarves that I am enjoying. I went and wore the scarf out in public tonight just to run a couple errands, and people do look at you like you're just wondering, you know, they probably feel bad for you or something. So that's kind of weird, but whatever. It's really not that big of a deal. I usually wear my wig, but I'm getting used to just being like, this is fine. You might also notice that in every video that I do, it happens to be chemo day, and I'm always wearing an off-shouldered shirt. These are the best shirts I've found for port access. So that's why you're always seeing me these shirts. I have like 4 of them, all different colors. So what else? Keytruda, the immunotherapy, is so important as a part of my regimen for treating triple-negative breast cancer. One of the side effects I've developed this week is hand sores. Let's see if I can show you this. Doesn't that look terrible? Yeah. So a little bit on this hand, what happens is I itch them. So I got a prescription today for a stronger hand cream because I am trying to avoid more steroids. The steroids I'm getting for chemo as a pre-med are making me balloon up, gain weight. Hoping to hell it's just water weight. And I'm like, oh God, I do not want to take oral steroids as well, but I will in order to keep the Keytruda. Anything like the weight gain, all of that can be taken care of after treatment. I'm actually thinking ahead and really looking forward to getting into this whole new healthy me. There is so much that I've learned from having cancer, and so much I want to change about my self-care that I'm starting to change now. I'm really excited to delve into and continue to change once I'm through treatment. So I think I want to tell you about one struggle that I've had as of late. So having gone back to work has been a godsend. I love it. It forces me to not sit around at home thinking about cancer. It has been a complete godsend. I love my coworkers. I love the administration. I love everybody in the office. I love the children. It is my happy place. This past Wednesday, I had to go home after half of a day. I just was so not feeling well. I felt like I was on the verge of a cold. Tuesday and Wednesday. So I went home and I found myself thinking, I'm feeling guilty that I should leave. There is a huge battle in one's head I would imagine a lot of cancer patients can relate to this, between wanting to do your normal, wanting to be your normal, want to feel like the way you usually feel, and having to, you know, and not wanting to let people down. And the other side of it is, the other side of the battle is knowing you have to take care of yourself. This is a season. The most important thing right now is taking care of yourself. So it's funny to have this internal struggle, and I have to remind myself that right now my top priority is beating cancer, and that everything else does not really matter as much as I thought it did. It does matter, but when you have cancer, what matters the most changes, right? So there's a lesson in there somewhere. There's a lesson in there somewhere. I feel that there's a lot of lessons that I am learning through cancer. And actually, I would like to make another video on that, because that could make this really long. And I want to talk to you guys about something called the hero's journey. And I want to talk to you guys about internal struggles, and also about lessons that I've learned through having cancer and going through treatment that I think could really benefit anyone. So yeah, just, you know, to wrap this up, things that we thought were important, they're still important, but sometimes they need to be not as important as they were, because right now priorities need to change, right? So I'm trying not to feel guilty, like when I have to go home from work or when I have to miss a day. It's hard, but I'm getting better at it. And the wonderful thing is, it's not anybody making me feel guilty. This is all me. I have so much support at my school. It's just wonderful. Nobody is making me feel guilty. That's all in my head and what I am doing. So that's something I'm working on. So there are wonderful lessons through going through treatment and having to go through this journey. I'll stop it at that. This video is about 12 minutes now. I'll upload that, and yeah, I will try to get another video up before next Thursday. Maybe I'll do another one later tonight. We'll see. Anyway, thank you again for supporting my journey. If this video helped you, please share it with someone, and I love you guys, and have a great rest of your evening. Mwah. Take care of yourselves.